Hi guys, this is Precious and today I'll be telling you about the topographical anatomy of the thymus gland. So in this PPT, we'll know about what is thymus gland, where is it located in the body, what are the blood supplies, what are the lymphatic drainages and what are the nervous supplies to the thymus gland and some of the features about the major functions of the thymus glands. And in the end, we'll talk about the clinical aspects related to the thymus. So what is thymus? So thymus is a primary lymphoid organ located in the mediastinum and it consists of two lobes connected by an isthmus. If we talk histologically, we can say the thymus is divided into different lobules. Each one consists of a central medulla and a peripheral cortex. The thymus is an essential component of our immune system. It functions as the initial site of T cell immune maturation through the positive and negative selection processes. T cells gain their name as they mature in the thymus, and similarly, B cells are also named as they mature in the bone marrow. So, where is it located? The thymus gland is a soft bilobed organ which is encapsulated and it lies in the superior mediastinum and in the anterior part of the inferior mediastinum, which is close to the pericardium. It sits anterior to the great vessels of the heart and deep to the sternum. It extends from the level of the inferior poles of the thyroid gland superior to it to the fourth costal cartilage. Parallel to the gland on its left and right side are the phrenic nerves. And the two distinct lobes of the thymus, as I already told, are connected in the midline by an isthmus. So the blood supply to the thymus. Basically, the blood supply to the thymus comes from the internal thoracic artery as well as the superior and inferior thyroid arteries. The drainage is to the left innominate vein as well as the superior, middle and inferior thyroid veins. In the cortex of the thymus, the arteries form a series of complex arcades and in association with the reticular endothelial cells and white blood cells, they form the blood-thymus barrier. Moving on to the lymphatic drainage, the thymus has no afferent lymphatics and the lymph drains basically into the thymic lymph nodes located near the gland, that is the internal mammary, parasternal, tracheobronchial hilar and mediastinal brachiocephalic. If we talk about the nervous supply, we can say that nerve supply to the thymus is minimal and it arises from vagus nerves and sympathetic nervous system which extends deep into the thymus via postganglionic noradrenergic fibers. Now let's talk about what is the main function of the thymus gland. So the thymus is the location where hemopoietic precursor cells mature into T cells. Prothymocytes migrate from the bone marrow and enters the thymus gland at the corticomedullary junction. Once the maturation process has been completed, these T cells enter the circulation and form the basis for the adaptive immune system. The T cells have receptors that are generated from the random shuffling of the gene segments. Initially, a process known as positive selection, which occurs inside the cortex, checks if the developing T cell is able to recognize self-MHC proteins, which are a set of proteins on the cell surface of a person, and hence they are able to recognize the person's own cells from the foreign cells. Basically, the cells that do not perform this reaction or perform it too weakly are prevented from entering the further development. So the next stage is negative selection. Here, the T cells undergo the process of interaction with the thymic dendritic cells, and those cells with high level of autoreactivity are eliminated to reduce the likelihood of autoimmune reactions inside the body. As a result of this process, There is a large amount of T cells built up over early life so that by adulthood, when the organ is largely obsolete and is degraded, the gland continues to have an endocrine function. So T cells are divided into T helper cells and T killer cells, also called cytotoxic cells. So cytotoxic T cells have CD8 plus proteins on their surface and attach to infected cells and they destroy them directly. So the helper T cells receive information about the pathogen from the antigen presenting cells, which are the B cells and the macrophages, and therefore coordinate the immune response by releasing cytokines, which further cause further white blood cell division and drive the production of the memory B cells for future infections from that pathogen. So let's talk about some of the clinical aspects, some of the clinical diseases which are related to the thymus gland. The first pathology is thymomas. So this is an uncommon tumor arising from the epithelial cells of the thymus gland. It has an association with myasthenia gravis in majority of like 20% of the patients, we can say. And other risk factors include advanced age and Asian ethnicity. So the main symptoms in this disease, they are caused by expanding tumor compressing surrounding structures like vena cava compression, dysphagia, cough, chest pain, etc. And to diagnose this pathology, we can use a CT scan. And for the treatment, basically it's done with the surgery, with the additional chemotherapy and radiotherapy in some cases. So the next pathology is myasthenia gravis. So this is an autoimmune condition characterized by worsening tiredness of the muscles as the day goes on and the muscles are utilized more and more. The symptoms result from autoimmune destruction of the acetylcholine receptors found in the postsynaptic neuromuscular junctions due to the autoantibodies. So diagnosis is made with the 10 Ceylon test that temporarily improves the symptoms, and the treatment for this disease is basically the patients are given long-acting acetylcholinesterase inhibitors as well as immunosuppressant drugs. And surgery to remove the thymus gland is also a treatment option if we don't have anything else and the disease it's in last stage. So basically we can say myasthenia gravis is a disease that causes the muscles to become weak. So the next syndrome which we come on to is DiGeorge syndrome. In this syndrome, there is an aplasia of the thymus that causes profound detrimental effect on T cell development and causes immunodeficiency and hence susceptibility to infections. Basically, this syndrome is a syndrome which is caused by a deletion of a small segment of chromosome 22, specifically 22q11.2, and in this no other white blood cells are affected, only the some of the white blood cells are affected, and the features of this syndrome are the cardiac abnormality, cleft palate, and hypoparathyroidism. So that was it. I hope you liked it. Until next time.